Welcome to the PowerPoint on stress and adaptation. On this slide, you have examples of physiological stressors, including the following: chemical, like smoking, poor water quality, alcohol, artificial sweeteners, pesticides, nicotine, chemicals in cleaning products, and so on and so forth. Physical stressors like intense exercise, excessive heat or cold, injuries, illness, sleep deprivation, surgery, infection. Infectious agents like bacteria, viruses, fungi, mold. Nutritional imbalances like vitamin and mineral deficiencies, food allergies, excess sugar, high intake of processed foods, and caffeine. Genetic or immune disorders like rheumatoid arthritis, osteoarthritis. Examples of psychosocial stressors include accidents, stressful or traumatic experiences of family members and friends, including deaths, divorces, horrors of history like wars, genocide, fear of aggression or mutilation, events of history that are brought into our homes through television, like the attacks on the World Trade Center and the Pentagon, things we see on the internet, and the rapid changes that are happening in the world. What is the role of the nurse in stress adaptation? Anytime you see what is the role of the nurse, I would probably know that kind of stuff. Our role involves recognizing stress and anxiety and the associated physical and psychological responses, understanding the causes, and implementing holistic nursing care strategies to help our patients cope with physical and emotional responses during periods of health-related stress. The local adaptation syndrome, or LAS, is a localized response of the body to stress. It involves only a specific body part, such as a tissue or organ, instead of the whole body. The reflex pain response is a response to physiologic stress that is a component of the local adaptation syndrome. General adaptation syndrome, or GAS, describes the physiologic changes your body goes through as it responds to stress. These changes occur in stages: an alarm reaction, also called fight or flight, a resistance phase in which your body recovers, and exhaustion. And then, let's see. General adaptation syndrome, or stress GAS, or stress syndrome, is characterized by a chain or pattern of physiologic events. You've got your alarm reaction, then you have the shock phase, the counter shock phase. Stage 2 is stage of resistance. This occurs when the body's adaptation takes place. The body attempts to adjust with the stressor and to limit the stressor to the smallest area of the body that it can deal with. And then we have the stage of exhaustion, which is stage 3. The adaptation that the body made during the second stage cannot be maintained. The ways used to cope with the stressors have been exhausted. And then we have stressors stimulate the sympathetic nervous system, which in turn stimulates the hypothalamus. The hypothalamus releases corticotropin-releasing hormone, or CRH. During times of stress, the adrenal medulla secretes epinephrine and norepinephrine in response to sympathetic stimulation. Significant body responses to epinephrine include the following: increased myocardial contractility, which increases cardiac output and blood flow to active muscles; bronchial dilation, which allows increased oxygen intake; increased blood clotting; increased cellular metabolism; increased fat mobilization to make energy available and to synthesize other compounds needed by the body. At the alarm reaction stage, a distress signal is sent to a part of the brain called the hypothalamus. The hypothalamus enables the release of hormones called glucocorticoids. Glucocorticoids trigger the release of adrenaline and cortisol, which is a stress hormone. The adrenaline gives a person a boost of energy. Their heart rate increases and their blood pressure rises. Meanwhile, blood sugar levels also go up. These physiological changes are governed by a part of a person's autonomic nervous system, or the ANS, and that is called the sympathetic branch of the nervous system. The alarm reaction stage of the gas prepares a person to respond to the stressor that they are experiencing. This is often known as fight or flight. Your heart rate increases, your adrenal gland releases cortisol, which is a stress hormone, and you receive a boost of adrenaline, which increases energy. The question on the slide about how shock and countershock phases can be masked by which cardiac medication class. Do you know the answer? The answer to the question is beta blockers essentially block the body's natural response to the hormone epinephrine, more commonly known as adrenaline, by standing between a beta receptor and the adrenaline that is telling it to get into fight or flight mode. During the resistance stage, the body tries to counteract the physiological changes that happen during the alarm reaction stage. The resistance stage is governed by a part of the autonomic nervous system called the parasympathetic. The parasympathetic branch of the ANS tries to return the body to normal by reducing the amount of cortisol produced. The heart rate and blood pressure begin to return to normal. If the stressful situation comes to an end during the resistance stage, the body will then return to normal. However, if the stressor remains, the body will stay in a state of alert and stress hormones continue to be produced. This is, I feel like, how we get into that state of anxiety, because our body doesn't know, hey, you can shut off those stress hormones now, because we start living in this constant state of stress. This physical response can lead to a person struggling to concentrate and becoming irritable. I feel like this is kind of where some of you are getting right now in block 1. You're getting overwhelmed and you're getting stressed and anxious. I feel like you're probably relating to this PowerPoint. The stage of resistance is characterized with the return of many physiological changes to their normal level, in addition to maintain increased blood glucose, cortisol, and adrenaline levels, increased blood pressure, cardiac rate, and respiratory rate. Now we hit exhaustion. After an extended period of stress, the body goes into the final stage of gas, known as the exhaustion stage. At this stage, the body has depleted its energy resources by continually trying but failing to recover from the initial alarm reaction stage. Once it reaches the exhaustion stage, the person's body no longer is equipped to fight stress. They may experience tiredness, depression, anxiety, feeling unable to cope. If a person does not find ways to manage stress levels at this stage, they are at risk of developing stress-related health conditions. The stage of exhaustion, which can lead to death, is characterized with the complete loss of and exhaustion of all the body's resources and mechanisms. In psychology, homeostasis alludes to the tendency of the human body to seek balance or equilibrium and stability. Homeostasis suggests a balanced equilibrium for physiological as well as psychological states. Psychosomatic, or somatic for short, refers to the mind-body connection. Homeostasis is stability and balance in the systems of the mind-body. It is the holistic association and interactive process between wisdom, thinking, belief, and physiological reaction, which critically affects health. The main goal of nursing is to maintain mind and body in a healthy state of well-being. It's perfectly normal to experience anxiety from time to time. Anxiety disorders, however, are mental health. I lost my place. They are mental health disorders marked by severe and persistent anxiety, including symptoms like excessive worry, hyperarousal, and it disrupts your day-to-day function. Anxiety is among the most common mental disorders in the United States. What is the body's physiological response to anxiety? The ANS produces your fight or flight response, which is designed to help you defend yourself or run away from danger. When you are under stress or anxious, the system kicks into action and physical symptoms can appear. Headaches, nausea, shortness of breath, shakiness, or stomach pain. The adrenaline surge through our bodies gives rise to that extra energy to escape from danger, the fight or flight response, producing stress, anxiety, and nervousness. When stress becomes chronic and homeostasis is disrupted for too long, overtaxing the body's adaptive mechanisms, our health suffers. So here's some mild symptoms. It's usually mild or subclinical. Mild anxiety can impact a person's emotions, relationships, ability to socialize, and performance at school or work. Mild anxiety symptoms are similar to those of social anxiety, including constant worries that are ignored, nervousness, nausea, shakiness, and sweating. Although most of these symptoms occur in most people with anxiety disorders, in people with mild anxiety, they aren't debilitating. A person with mild anxiety may come across as being shy, self-conscious, or even a little awkward. These symptoms are usually present since childhood and can progress into adulthood if left unaddressed. In addition to worsening symptoms, the development of unhealthy coping strategies such as alcohol abuse is a serious concern for people who do not receive counseling or therapy for mild anxiety. Moderate anxiety is anxiety level 2. It involves more frequent or persistent symptoms than those of mild, but still allows for daily functioning in comparison to severe anxiety or panic disorder. For instance, people with moderate anxiety may experience symptoms like jitteriness or feeling on edge, being unable to control their worry, or being unable to relax for most days of the week. Although moderate anxiety symptoms are disruptive, they aren't debilitating enough to disrupt the person's day-to-day routine or prevent them from fulfilling responsibilities at home, school, or work. Again, however, it is important to note that even moderate anxiety should be treated, as individuals with anxiety disorders are likely to develop harmful coping habits that could worsen their symptoms in the long run. Severe, which is the third level of anxiety, is where debilitating symptoms begin to emerge. Severe anxiety symptoms meet the diagnostic criteria for clinically significant anxiety disorder or generalized anxiety disorder. There are physical symptoms of severe anxiety, including head and stomach aches, shakiness, and frequent urination, and then there are behavioral symptoms like the inability to control worrying, distress that's disproportionate to the situation, inability to relax, difficulty concentrating, and more. People with severe anxiety usually experience more distress and less ability to function. A person with this condition may also report symptoms similar to those of major depression, such as fatigue, headaches, and impaired concentration and memory. Severe anxiety symptoms are persistent and frequent, making it more difficult for the person to function and complete even the most basic tasks. Panic, the fourth level of anxiety, is characterized by frequent, recurrent, and unexpected panic attacks. Common panic attack symptoms include sudden onset of extreme fear and sense of doom, heart palpitations or rapid heartbeat, rapid breathing, nausea or dizziness, fear of death, loss of consciousness, or fainting. In people with panic disorder, panic attacks usually last about 10 minutes and they can occur unexpectedly. Panic attack triggers vary from person to person, so it's helpful to work with a therapist or a mental health specialist to determine what these triggers are and develop appropriate coping mechanisms. Coping mechanisms, simply defined, is the patient's ability to institute, maintain, and regain psychological homeostasis when this homeostasis is disrupted for one reason or another. Coping may be adaptive, and it can also be useless and maladaptive. Coping is adaptive when it resolves the stress, and it is maladaptive when it does not resolve the stress or it creates further problems for the client. For example, alcoholism that results from a client's self-medication to cope with the loss of a loved one not only does not solve the stress associated with this situation crisis, it also leads to depression and other psychological and physical health problems. Coping strategies are thoughts, behaviors, perceptions, and emotions that a client can and does use to cope with stress and any other disruptions of psychosocial homeostasis. Stress significantly and adversely impacts the client and their physical, mental, and social health and well-being. Coping mechanisms. Here's some more. I feel like we can read them. Let me see. Blah, blah, blah. Here's what the nurse should do. Assess the client's support systems and available resources. Assess the client's ability to adapt to temporary, permanent role changes. Assess the client's reaction to a diagnosis of acute or chronic mental illness. So think about rationalization, hopefulness, and anger. Are those typical reactions we see? Assess the client's ability to cope in life changes and provide support. Identify situations which may necessitate role changes for a client, like a spouse with chronic illness or the death of a parent. Provide support to the client with unexpected altered body image, like alopecia, or maybe they have a traumatic accident and they end up having an amputation, or they have a traumatic accident and have a scar on their face that is changing their self-image. Evaluate the constructive use of defensive mechanisms by a client. Evaluate whether the client has successfully adapted to situational role changes. Task-oriented coping attempts to solve or limit the impact of the stressful situation. Emotion-oriented coping tries to limit the emotional impact of stress rather than resolve the stressful situation. So avoidance-oriented coping uses distraction and diversion unrelated to the stressful situation to reduce stress. So a task-oriented coping approach involves direct action. The direct action taken seeks to change the situation itself to relieve the stress it is causing, whereas an emotion-focused approach seeks to deal entirely with the emotional response to a stressor, and an avoidance-oriented approach would seek to avoid the issue altogether. Task-oriented reactions to stress, attack behavior, occurs when a person attempts to overcome obstacles to satisfy a need. It may be constructive with assertive problem solving or destructive with feelings and actions of aggression and hostility. Withdrawal behavior, the person can physically withdraw from the threat, or the emotional reaction is guilt or isolation. Compromise behavior, usually constructive, substitute goals or negotiation. Compensation, excel in something else to make up for the lack. Denial, act as if the issue does not exist. For alcoholics, patients refuse to admit their problem, or their family members also will cover up the problem. Displacement, transfer the emotional response from the actual situation to another situation. The person kicks the dog instead of dealing with the problem. Dissociation, blocks out traumatic events that have happened. Projection, switches thoughts about a person and their response to the person. I am not attracted to him, my best friend is. Rationalization, displays a negative behavior and justifies that behavior as being appropriate. We explain it away. I knew that teacher was out to get me. Or when we rationalize how we need to buy something when we know we absolutely do not have the money for it. Do we need it or do we just want it? We can rationalize a lot of things. Introjection, adolescent who takes on values of their favorite teacher. Adaptation to ill health refers to the phenomenon that individuals over time adjust to a deterioration in their health. Adaptation may lead to an increase in reported levels of quality of life, even if the health status has not improved. So general tasks, for example, maintaining self-esteem and personal relationships. Illness-related tasks, for example, handling pain and disability. So what this is saying is adaptation is that over time the person gets used to the fact that they have some chronic illness, they learn to manage it, and they don't see it as a life-limiting thing. Not all stress has negative effect. Studies have shown that short-term stress boosts the immune system, but chronic stress has a significant effect on the immune system that ultimately manifests as an illness. Okay, I had to pause for a second. So it raises catecholamine and suppressor T cell levels, which suppress the immune system. This suppression in turn raises the risk of viral infection. Stress also leads to the release of histamine, which can trigger severe bronchoconstriction in asthmatics. Stress increases the risk for diabetes mellitus, especially in overweight individuals, since psychological stress alters insulin needs. Stress also alters the acid concentration in the stomach, which can lead to peptic ulcers, stress ulcers, or ulcerative colitis. Chronic stress can also lead to plaque buildup in the arteries called atherosclerosis, especially if combined with a high-fat diet and sedentary lifestyle. The correlation between stressful life events and psychiatric illness is stronger than the correlation with medical or physical illness. Deficiency needs are concerned with basic survival and include physiological needs such as the need for food, sex, and sleep, and safety needs such as the need for security and freedom from danger. Behaviors associated with these needs are seen as deficiency motivated, as they are a means to an end. Deficiency needs arise due to deprivation and are said to motivate people when they are unmet. Also, the motivation to fulfill such needs will become stronger the longer they are denied. For example, the longer a person goes without food, the more hungry they will become. Unmet basic needs. Food, housing, personal, neighborhood safety, money for necessities is directly related to an increased stress reaction affecting almost every organ in the body. Additionally, food insecurity is also associated with worse physical and mental health, including eating disorders, obesity, stress, poor sleep, anxiety, and depression. Common effects of stress on health and illness. Stress symptoms can affect your body, your thoughts and feelings, and your behavior. Knowing common stress symptoms can help you manage them. Stress that's not dealt with can lead to many health problems such as high blood pressure, heart disease, stroke, obesity, and diabetes. What are the health problems associated with family stress? Family relationships in particular can bring a specific set of challenges because they are usually several people involved, all or most of whom likely have a long history together. Unresolved conflict or lack of communication can make family life incredibly complex. In families with different dynamics, conflicting expectations and misunderstandings can be a source of stress. Tension can still arise even when the family members get along well. Whether the family is welcoming a new baby, navigating health problems, or dealing with financial trouble, stress can affect all. Family members might experience headaches, muscle pains, elevated blood pressure, or digestive issues while at home, which may affect daily life within the household. In extreme or prolonged cases, stress may even affect family functioning or change the ways family members interact with one another. Anger and feelings of helplessness and guilt, loss of control over normal routines, concern for future financial stability. Some main family stressors include finances, parental relationship issues, health problems, loss of life, relocation, and addition of a new family member. Crisis. Crisis is the building of stressors to beyond a point where a person can handle the situation. During stress, a person can still function. During crisis, the person will be unable to function and will need assistance to get back to functioning levels. What causes stress? Feel under lots of pressure, face big changes in your life. You're worried about something, don't have much or any control over the outcome of a situation. You have responsibilities that you find overwhelming. You don't have enough work, activities, or change in your life. You experience discrimination, hate, or abuse. Stressors can be good or bad, brief or long-lasting. They can be positive. They can have positive effects and negative effects on our health, relationships, and growth. There are 7 types of stressors. Physiological stressors. Lifestyle stressors, major life event stressors, organizational stressors, financial stressors, social stressors, environmental stressors, and all of these have different descriptions of them, but I will let you look those up in your book. Developmental stress. That's the normal growth experiences of childhood, dealing with strangers as an infant, being separated from parents, starting or changing schools. I don't know that we need to go into too much of that because that is more as it goes with children. Situational stress can cause temporary physical symptoms like difficulty concentrating. Let's go to the next one. Negative situations can cause stress, that cause stress are bound to occur in almost every single kind of nursing job. That is putting it mildly. I'm just going to say that for y'all. A patient's health might decline rapidly while you are in charge of their care, or you might find yourself short-staffed. You just might. And under pressure to serve too many patients. That could happen. Your peers might be inexperienced and make mistakes, or you might be inexperienced and make mistakes. A nurse may assume responsibilities for which you thought you were prepared, but you're not. Or you're working in an environment in which supervisors are not supportive. Or you're caring for a patient in cardiac arrest or a dying person, and you are not comfortable with it. You're experiencing conflict with your peers. You're caring for a patient who's disengaged or non-adherent, or being unable to take a correct, right, or ethical course of action. So these are some different types of activities of daily living that we can do ourselves as well as teach our patients to do. Those are skills that are required to manage our basic physical needs, like personal hygiene or grooming, dressing, toileting. The instrumental activities of daily living include more complex activities related to the ability to live independently in the community. Managing finances and medication, stress management and techniques, food prep, housekeeping, laundry, that kind of thing. I feel like I went too far. Did I? No, I'm fine. Chronic stress has a significant effect on the immune system that ultimately manifests as illness. We already read all this. I don't know why I'm back to this. So I am going to skip this slide and go to this slide. So relaxation techniques can have many benefits, such as slowing the heart rate, lowering blood pressure, slowing down your breathing, improving digestion, controlling blood sugar levels, reducing activities of stress hormones. I mean, really, all of these are the opposite of what anxiety does to the body. So this relaxation it decreases anxiety. Increases blood flow to major muscles, improves focus and mood, improves sleep quality, lowers fatigue, reduces anger and frustration, boosts confidence to handle problems. And some different relaxation techniques could include deep breathing, count in for the count of 4 and out for the count of 4. Or you could do in for the count of 4, out for the count of 8, or in for 8, out for 4, whatever. But paying attention to your breathing. Massage, meditation, tai chi, yoga, biofeedback, music and art therapy, aromatherapy. Mindfulness is a type of meditation that if you pay attention, there are a lot of classes right now on campus about mindfulness. Some of them might even be free, I'm not sure. It helps you to focus on being aware of what you're sensing and feeling right now in the moment without interpreting it or judging it, just being aware. Practicing mindfulness involves breathing methods, guided imagery, and other practices to relax the body and mind and help reduce stress. We could all use a little bit of that. Anticipatory guidance is information provided to a patient by a healthcare professional to prepare them for what to expect in a variety of different situations. So it's sort of like we're going to tell you what to expect when you go down for this diagnostic test, or we're going to tell you what to expect during the surgery and then for your recovery after the surgery. So the more information they have, the more in control they feel of their outcomes. Changes and transitions may be easier for some patients to deal with if they know what to expect in advance. Basically what I just said. Anticipatory guidance can be used by professionals in a variety of situations to educate, reassure, and advise. And I just gave you examples. Guided imagery is a stress management technique where you use your imagination to picture a person, place, or time that makes you feel relaxed, peaceful, and happy. Imagery is slightly different from other stress management techniques in that it relies on the use of all of your senses and involves concentrating on a specific object, sound, or experience in order to calm your mind. In guided imagery, you intentionally think of a peaceful place or scenario. Crisis intervention is a short-term management technique designed to reduce potential permanent damage to an individual affected by a crisis. The crisis is defined as an overwhelming event which can include divorce, violence, the passing of a loved one, or the discovery of a serious illness, the urgent and temporary care given to an individual in order to interrupt the downward spiral of maladaptive behavior and return the individual to their usual level of pre-crisis functioning. When a person experiences a highly stressful or traumatic event, they can go into crisis afterward because they cannot process what happened independently. Crisis intervention can help immediately determine what they need to do to ensure their safety, de-escalate their feelings, and make a plan for appropriate resources and ongoing treatment. If someone experienced a traumatic event a long time ago, they can still go into crisis if they are triggered in the present moment. Crisis intervention can help them return to the present moment, process the trigger, and manage their symptoms until they can connect with their treatment team. People with various mental health diagnoses, including mood disorders, Psychotic disorders or substance use disorders might experience a sudden acute increase in their symptoms. They can benefit from crisis intervention to ensure immediate safety, utilize appropriate coping skills, and connect with ongoing treatment options. Crisis intervention has several purposes. It aims to stabilize the patient in the current situation, reduce the intensity of the emotional, mental, physical, and behavioral reactions, help individuals return to their level of functioning before the crisis, improve functioning above and beyond this by developing new coping skills and eliminating ineffective ways of coping, such as withdrawal, isolation, and substance abuse, assist individual in coping with future difficulties more effectively. A crisis occurs when someone perceives or experiences an event or situation as intolerable, with demands that exceed their current resources and coping mechanisms. When this happens, they need assistance to regain control and stabilize. The 6-step model enlists a systematic process of listening and responding to empower the individual and help them return to their pre-crisis psychological state. Assessments occur at every step, and the crisis worker listens attentively to make their evaluations. The 6 steps involved in this method include 3 listening-oriented steps and 3 action-oriented steps. The first 3 focus on listening. We ask the crisis, step 1 asks the crisis worker to define the problem. The first stage establishes a connection between the crisis worker and the client as they begin discussing the issue. To fully understand the situation and form a bond with the client, the crisis worker implements active listening, empathy, genuineness, and understanding. Step 2, we want to ensure this individual's safety. A vital part of any crisis intervention plan is assuring the individual cannot harm themselves or others. At this stage, the crisis worker conducts suicide risk assessments and homicide risk assessments. You may evaluate factors like agitation or the client's potential for causing harm. Step 3 is provide support. In the 3rd step, the crisis worker shows the client that they accept and care for them. They'll discuss the problem and offer support for meeting basic needs. These might come in the form of emotional support, instrumental support, and informational support. Emotional support is the worker must express emotional support through statements that illustrate empathy, trust, and care. Emotional support can also come from trusted friends and family. Instrumental support refers to services and aid like shelter and food. Fulfilling basic needs is a necessary prerequisite for the problem solving that occurs in the next 3 action steps. Informational support is providing information support, basically. The crisis worker offers advice and suggestions. You might teach the individual about healthy coping strategies or reassure them that many resources are available. The goal of these supports is to set the person up so that they can understand the options available for dealing with the situation, which takes us to step 4, exploring alternatives. We switch gears into the action steps. We find new solutions and navigate possibilities with our patient. If their coping skills are weak, the crisis worker may need to offer more assistance at this step, but it's important to draw on assessments first to understand the client's capabilities. Situational supports like people in the individual's life who care about them, or coping mechanisms that can help them through the situation so they can move into the problem-solving stage. During this step, it's necessary to use and cultivate positive, constructive thinking patterns. The crisis worker may need to spend some time helping the client reframe their thoughts in more positive ways. Step 5, make plans. With trust established and options explored, it's time to make a plan. During step 5, the individual and the crisis worker continue to collaborate, building a plan with clear, concise steps that will help the client regain control. These plans must be realistic and achievable. Remember how our goals have to be that way too? They should empower the client, making them feel like they can accomplish the tasks and take ownership of the recovery process. This step relies heavily on collaboration with the client, so do our setting our goals and doing our plans of care, because it helps them take control, using their existing resources and capabilities. The individual's plan should be detailed and straightforward. It might involve referrals and resources like people or groups that can help the client, such as support groups, medical providers, or food banks. And then obtain commitment is step 6. The last step is this step. Getting commitment might be as simple as asking the client to verbalize a plan, or as complex as writing up a document and having both parties sign it. In either case, the crisis worker needs to confirm that the client fully understands the plan and feels capable of following through. The crisis worker should also make plans to follow up with the client. You can create a sense of accountability and, of course, help ensure the client's well-being. If the client needs further care, the crisis worker can also make referrals. Step 7, which is the very final step, is evaluating the plan to see how the outcomes were. When evaluating the care plan, check to see if the patient is able to verbalize the causes and effects of stress and anxiety in their life. The patient identifies and uses sources of support. The patient uses problem solving to find a solution to stressors. The patient practices healthy lifestyle habits and anxiety reducing techniques. The patient verbalizes a decrease in anxiety and an increase in comfort. And we are finally at the end of the chapter. Thanks for listening.